Hi, everyone. So we will get started with today's workshop, hosted by one of AgeWell's National Innovation Hubs for Advancing Policy and Practice in Technology and Aging. Thank you all for coming to our session today. We look forward to introducing you to how to engage in the policy space and working through an activity that we have prepared. So slide, Patrick. So just a quick overview for you for today's workshop. We will provide an introduction to policy. So what is it and what are the 6 Ps, just to give you some context to where research can be used and leveraged to inform the public policy development process. And then we'll introduce you to the vehicle for advising on public policy, and that is through a policy brief. You may have heard of this kind of document, or you may not have, and this is all new to you, which is also great. So we will be introducing our recommended template for that, and then we'll be working through how to develop an issue statement that really sets you up for the narrative of your policy brief. So this is what we're talking about today, and if you are in the wrong session, you have the modern advantage to just leave the room instead of the awkward lecture hall exit. So hopefully you are here for the right session, and feel free to engage in the chat, and I hope you all enjoy. So we hope that you develop from this session an understanding of where and how evidence can inform public policy. And we look forward to discussing your research and the possibilities of policy application with it. And then with you developing an issue statement with the support of the APPTA team. So with that, Patrick.
Yeah. Oops. Okay, why is it not? Okay, there we go. Right. Okay, so I'll cover kind of the overall theory, I suppose, of policy and program formation and how research could potentially contribute to that. So when you're working in the policy arena, one of the things that can be a challenge can be language. So there are the rules, procedures, and guidelines that are specifically called policy. But then we also have standards for service provision, guidelines for practice, or strategies with political commitments, all of which cover the same ground as policy, but go by different titles. Policies are also made on different scales to address a wide variety of concerns. So at the larger end, they range from international agreements to address global concerns, such as climate change, but it can go right down to local and sometimes trivial issues, like the policies that a condo board puts in place around whether or not residents can hang colored lights from their balconies. The common thread is that policy formally outlines key objectives to fit specified purposes. So with the examples I just mentioned, those would be setting greenhouse gas emission targets, limit climate change, or keeping a uniform appearance on a condo building in order to maintain property values. In turn, policy objectives lead to programs, which are the sets of actions that are designed to meet stated policy goals. And potentially, your research could inform policy formation in any of those spaces. When you're thinking about how your research can inform policy, it's often useful to first take a step back and consider the stages in policy development. So first, the issue needs to be identified and framed. This may seem self-evident, but it can actually be fairly complicated in practice. People have different interests in relation to any topic. So some people may not see the issue as a problem at all. Or alternatively, they may look at the boundaries of the topic and look at it in ways that exclude some aspects or bring other aspects in. And research has an important role to play in this stage in cutting through those complications to effectively define an issue. In particular, research can generate evidence on the scope or the prevalence of a problem, And it can also generate insights into how the problem occurs and how change could potentially be achieved. The stage after that is the development of policy options. And researchers have a very important role in turning primary research into actionable policy options. So this could take the form of scoping evidence. So you're synthesizing findings from multiple studies to show general patterns. But it could also take the form of jurisdictional scans to look at what other policy actors have done in relation to an issue in similar circumstances to the one where your policy might be implemented. And finally, the knowledge accumulated through research can be put to work in making evidence-based recommendations. So those identify actions that are strongly supported by evidence and by prior application in other jurisdictions. Research can also contribute to successful implementation in other ways. So it could potentially identify factors that could become barriers or facilitators for the initiative. Policy change efforts usually fall within two general types. So the first would be making amendments to policies that are already in place. This can be necessary when the context changes around an existing policy, making it less effective, or alternatively, when the values around the policy's goals have changed. For example, when policies about medical records and how those are handled were originally drafted, in-person medical visits and physical records were the norm. But as communication technology has become much more powerful and is applied to things like telemedicine or virtual care, there's now the need to update many of those policies to cover electronic storage and transmission of medical records. So when you're doing research to inform policy amendments, a researcher has the advantage of being able to draw on current and past policies. But that comes with some potential problems, and you may face challenges because the existing system could limit options for practical change. In the second type of policy change, you're looking at developing new policies for a topic that hasn't yet been covered under existing frameworks. An example of that could be, or would be, the implementation of mandatory seatbelt laws in Canadian provinces in the 1970s and 1980s. Looking back on it, those laws and policies may seem like just pure common sense. But when I was a kid, my family owned several cars that were manufactured without standard seatbelts. And I can actually remember the controversies around the introduction of those laws when they were initially put in place. So when your research is informing that kind of a policy change, a large part of your job as a researcher may actually be to convince the decision makers that the topic is worth implementing any kind of a policy at all. Whether or not you're working on amending policies or are developing an entirely new one, the policies need to meet several criteria. So they need to be sanctioned, which means they need to have the support and formal approval of decision makers and executive management that are responsible for that issue or that topic area. It needs to be applicable. So it needs to be a topic that decision makers recognize as being worthy of attention. And as I just mentioned, your research may well be part of spelling out that applicability. The policy has to be realistic, and in that, I mean, it has to be feasible to implement with clear and attainable goals. But it also is important that it be flexible. So the flexibility will help the policy be adapted to conditions within or across jurisdictions. And potentially it can also help with uptake or acceptance by decision makers if a policy is flexible enough to be altered somewhat in response to the needs of different interests. has to be comprehensive, so it needs to include all likely relevant parties and consider impacts on them. And finally, it needs to be enforceable. So the proposal has to spell out what administrative controls will be in place to support implementation, who will be sanctioned to enforce it, and there needs to be at least some thought about a management plan to carry that enforcement out. So once you have your policy issue framed and the criteria worked out, it's worth considering the components of policy, what we refer to as the 6 Ps. So the first one is your policy problem, and it essentially winds up being the focal point for the policy making, and it largely drives the process. So identifying the problem and evaluating its scope can be done in a number of ways. It could be through proactive research and planning, such as needs assessments to identify key areas for intervention, or analysis of administrative or population data that can outline the need for intervention. But it could also occur through reaction to something that emerges in relation to an issue, such as a crisis. And the COVID pandemic provides a great example of this. It was largely unanticipated, but once it occurred, it spurred rapid policy development in a number of areas. It's also worth keeping in mind that policymaking is fundamentally a social process that's driven by the people who are participating in it. So your various stakeholders are going to be involved in the policy process, and their places inside and outside organizations they represent, their views on the problem and the roles that they play in the process, all can impact how a policy making decision is going to happen. Then once the decision actually occurs, people will also determine how the policy is implemented through decisions around management, enforcement, evaluation, and alterations to the policy for its ongoing development. And as mentioned earlier, the process of policy development has multiple steps. So you're framing the scope of the problem, getting on agendas, developing options, and those are all ongoing parts of the process. In addition, decision makers are well aware that policy change involves costs. So the price tag for implementing a policy becomes one of those points where great ideas and options can completely fall flat. And as a researcher, if you don't have the supporting information at hand, like cost-benefit analyses, or at least laying out possible resource allocations that are going to be needed for implementation, then it becomes like you're presenting something with pieces missing, and that can damage your credibility. Depending on the goal and the scope of the policy that you're trying to inform, it's worth considering how you can quantify potential costs. So those could include costs for devices or equipment that will be needed, staffing or personnel costs, development costs, and really anything else that will be involved in turning that concept into practical action and then maintaining it on an ongoing basis. Then, because policies are formal decisions, they're surrounded by legal paper. So the written legislation is going to provide the broad framework for policy that the policy is going to exist within. And as well, once programming is put into place, it will also have to comply with existing regulatory structures. So you're always going to wind up dealing with that paper aspect. And it's essential as a researcher to consider what written policies are in place or the legislation that could impact the policy that your research is informing. And finally, once the policy is actually adopted, programs emerge through the implementation. So that could or will involve a large number of practical actions. So the allocation of resources, outcome evaluation, and so on for as long as that policy is going to be in place. Now, while the previous slides kind of could give the impression that policymaking is a linear process, in fact, the reality is quite a bit messier, and it winds up being more like a circle. So you got your problem in the center, and the other parts are going to be revolving around it over time. So your people are involved in the process, and then they're managing price tags and paper, then taking action through programs and going through the process again as adjustments are made. And as this policy wheel spins, it's going to be hitting bumps and sometimes being sped along as the political, sociocultural, and economic contexts influence the process. So then the real question, and really why we're here today, how can you use your research to influence policy effectively? And sadly, there is no simple answer to this. It really does depend on the nature of your research and the specifics of the policy issue. The information from research can often translate into policy or practice areas, but the research doesn't speak for itself. It's not enough to have high quality data, and it's not enough to analyze it carefully. To get your insights on the agenda, it's essential to be able to take the policymaking context into account and put the research forward in ways that are accessible to decision makers. So that kind of wraps up my part. And in the next bit, we're going to shift the focus a little bit away from the theory and toward more practical aspects of how you can go about communicating your research. So I'm going to hand it over to Jenna to talk about how to go about communicating effectively in the policy arena.
Yeah, that's great. And we'll segue this with a bit of a poll. In true fashion for myself, I forgot the very first poll, but they segue nicely together. So we will launch a poll about your area of research. So this should appear on your screens now. So just take a few seconds to highlight the area of research. And if you're in the other category, it would be great if you could put it in the chat. And I'm sorry for missing your discipline if that's the case. Or if you don't see this, please let me know in the chat. I'm not sure if it's working. Okay, and poll. I don't see any responses, so I'm not sure if that one was working. But maybe we'll just try the other one. And if anyone's having problems, please feel free to type that in the chat as well, and we can try to figure that out. But so the next poll that we want to gauge is from Patrick's introduction and talking about the 6Ps and talking about the process, where is it that you think your research or research generally could apply to the policy context? So I'm launching poll number 2. Okay, thank you, Ashley. That it's not showing up on my end. So maybe that was the technical difficulty that we've seen earlier.
Jenna, I think it's showing on my end. So if you want the results, I can call them out.
Oh, perfect.
Yeah.
So if you can, you're able to end the poll and launch the results.
No, at this point, I'm only seeing poll 2 now. I don't know how I could go back to poll 1.
Poll 2 is fine. Well, I'm not seeing the results. So
I can see the results as well.
All right. How many people think that they can help identify population level issues to address with their research? Do you have
Right
a
now it
percentage?
says 10%.
Nice.
And 11 people have voted.
And what about clinical practice and guidelines?
27.
Great. And what about legislation and law?
0%.
That's fair. That's a hard one. So I totally understand. And what about for informing further research?
0% as well.
Okay. That one probably should be higher because, research just really tends to elicit how we can inform further research, but we will get to that. So I'll end poll since it's not working quite effectively. And
So
I'll
just a quick summary. So health research and clinical attendees, 62%, policy attendees, 31%, and other 15%.
Okay.
Yeah.
That's great. Well, I apologize to all of you about that technical difficulty there. I'll just start sharing my screen here. That should switch you and I, Patrick.
Yeah, I'm seeing your screen now, Jenna.
Swap displays. Okay. All right, so that segued us awkwardly but nicely into the first step to bringing your research to the audience that you intend to reach. So thinking about what area your research what area of research you're in and how that can potentially influence policy at particular levels helps you identify the levels of policy that your stakeholders are situated in. So is it at the hospital or institutional level, for example? So if you selected that you might inform clinical practice or clinical guidelines, then that means that you might want to focus on audiences that are in the hospital or institutional level of policy. So healthcare administrators, healthcare professionals themselves. And another couple of levels might be the regional health authority in your jurisdiction, or if you want to go national, regional health authorities broadly, whatever they look like, because I know they look different in each province or territory. But another just on that example, another area where you might want to look is areas of influence, which might be professional associations. So whatever area you're in, what is a professional association that regulates that profession? And what do they have going on that you could potentially leverage? And can they be a stakeholder that you identify? Are they a kind of a knowledge user in the space in which you have particular goals of influencing policy change? So knowing where these stakeholders might be, even at a conceptual level, can really help you and initiate you in starting where you focus. And so talking about influencing policy, the best and most often used format to do this or vehicle to do this is what is called a policy brief. And this shares the information and message that you want to relay to your audience. And it's important to note that you may see a policy brief or policy report, and it can be very long. A lot of times it can follow a 1:325 kind of ratio of a report, and that's definitely has a time and place. But for the purpose of what you're trying to do as a researcher and understanding who your stakeholders are, they're probably spread thin, getting pulled in many different directions, and also have people who are interested in getting their attention as well. So typically we suggest about 3 pages, give or take, of course, depending on how much information you have. And we'll continue to talk about this But the 1-3-25 structure is something that highlights a 1-pager of your key messages, a 3-pager of your executive summary, and about 25 pages of content in a report. So if we think about that, what we're suggesting is really doing your executive summary and really having all of the components in there. So before we get to the template, this is something that I like to recommend to build out your your goal and your purpose that really sets the stage for how you need to think through your approach. So by filling out the red letters or words here, you can really start to think about what your purpose is and what your intentions are. So this policy brief is for the Canadian Medical Association, for example, to get them to, even recommend the clinical practice changes that you're recommending, because it will contribute to this health outcome. So, or this policy brief is for healthcare administrators to implement a certain protocol post-surgery to contribute to reduced infections, for example. So there are many things that can kind of plug in here that can really help guide you to your overall intention. So this is the template that we recommend, and we can share that absolutely. And we have kind of more components underneath. So we're happy to share that template to you all. So we'll dive into each of these headers in a little bit more detail to talk about like the practical components of how you approach informing policy. So the issue is your issue statement. It's very brief. It's 3 sentences, maybe 4. And it's really important to consider what your research question is, but what led you to that research question? What is the problem that you were exploring? Because it's critical to frame your issue correctly. And it's also important to note that your issue statement is not your research question or necessarily the problem that you're identifying. It can be much broader. It can be the impacts of your research. Or the impacts your research are trying to address. And we'll get to that in an example here, but just consider these guiding questions, and these guiding questions, I believe, are in the template that we are able to share. But these guiding questions really help you frame what it is that you want to get across. So we're going to use a community-based example. So fall prevention, it's a bit of my background, so it's easy for me to talk about. But this is an example of an issue statement. So this was research conducted in community-based strength and balance exercise programs. So what you'll notice here is really not much about that particular study is in this issue statement. And that is because the issue that we're trying to address with that study is much broader than that. So what we wanted to do is reduce falls. What is the issue related to falls? Well, many falls, about 50%, actually occur in the home with community dwelling older adults. So that's why the rationale for a community-based program for those living independently in their home with the intention of keeping them there. So the impact of falls is that if they sustain an injury, that actually accounts for many hospital admissions. So kind of creating the narrative around the problem that you're trying to address is really important. And then you can really segue your issue statement with the kind of rationale that sets you up to introduce your research, which is improving strength and balance in individuals at risk will help reduce falls and increase independence. I'm not reading that verbatim, of course, but so getting into the second section is the background. So I think from my experience working with researchers, a lot of the time it's very hard to make a concise issue statement. But what I always say is you have your background. You have more of a word count in your background to really set you up for success and really set the context. So if there's something that you can't put in your issue statement for the sake of space. Your background is where you back up the issue that you're presenting with further stats, the history, what is known about the issue, what research has already been done, how can you build out the issue that you've already stated and are trying to present. So then with that, with setting context, the current status section really requires a bit more work. It's outside the scope of your research study or potentially your area of expertise. But what is the political landscape around the topic or just the policy landscape? Oh, my cat just jumped up. I apologize. So you might need to do a little bit of extra work to understand one, the level of policy that you're trying to address. So if this is at a hospital level or regional health authority level, then what are their current action plans or strategies? And what do they highlight in your area that you can potentially leverage? Or what are the province's what's the province's newly released strategy or action plan as it relates to your field? In our field, of course, it's the aging population, and provinces and territories come out with action plans to support their aging population. So you can take a look at those, but depending on what level of policy, you may have to look in other places. But it's important to understand those points of leverage, and we'll talk about those points of leverage in the recommendations section. And so for key findings, you want to bring about your research here, and you can briefly explain your message, no more than one point. You can always link to any further work you have published, if it's open access or available anywhere. And we'll get to that as well a little bit, but you want to really highlight within your methods and your identified outcomes 3 to 5 main points that really help connect everything. I'm sorry, my cat is not cooperating. Okay, so just an example of a couple of points, even though this is a bit of a paragraph, but how do you present your key findings? And we'll kind of work through this a little bit. So with the falls prevention example, so you'll note that the issue statement wasn't quite focused on one particular study for good reason, but now the key findings is really to highlight the study that you're referencing. So a multi-step fall prevention study showed positive outcomes for community-based strength and balance classes, for self-efficacy, improvements in strength and balance measures, and post-intervention interviews showed that the social component was important for retention, which is also important. So when thinking about the key findings and how all of these components kind of weave together to bring us to our recommendations, what role does government play here? So we're talking about community-based initiatives. So this evidence suggests that maybe governments who, sorry, Pepper. So maybe governments who choose which community-based initiatives receive funding could benefit from this information, and they can choose funding based on applications that actually show they have components of strength and balance, they have social components to increase retention. So what do these levels of government have to consider for a successful program that ultimately contribute to better measures, better health outcomes? And so that brings us to our recommendations. So this is where you're linking your background, your current status, and your key findings. So you've really started to build out the rationale for the actions and recommendations that you're bringing forward, as well as identifying that you've considered the possibilities of risk and areas to mitigate. So with the fall prevention example, since you've set the rationale for investing in community-based programs that focus on strength and balance, the outcome is reductions in falls and a benefit to the healthcare system. So this is, of course, a benefit to the cost associated, or the expenses that the healthcare system incurs as it relates to falls. So this preventative rationale can really be woven into those 6 Ps that Patrick was talking about, right? We might not have the skill set to do a full-blown economic analysis, but you can pinpoint where there is a cost associated with treating falls and injuries from falls for the healthcare system. So reducing it will, and reductions in falls and those at risk of falls is an added benefit to the healthcare system. So you can build your rationale out that way. So we are going to go in some breakout rooms. And what we're going to do is we are going to look at this abstract. And what I want you to consider in reading this abstract in your breakout rooms for a few minutes is, what is the overall message and what is the issue that is being presented here. So read it through, and in your breakout rooms kind of have that discussion, and we'll be here to help guide you. And then we'll loop back for a debrief. So we'll just end this. And I'll share it in the chat for everyone, just so we all have it. Oh, it's not letting me copy and paste it, it seems. Norma or Patrick, are you able to paste it?
Into the chat? Into the chat?
Yeah. I'll just set up the breakout rooms now.
Yeah. Oh,
it cut off.
I think it has a character limit.
Yeah, I have to go back and fetch it.
Okay. Well, we'll just put everyone in the breakout rooms, and then we'll go into them and maybe share our screens. Or even numbers are kind of low. Now I see that many people had to go, so I'll just share my screen. This is flexibility here. I'll share my screen again. I'm not sure which one is sharing.
It shows your full desktop rather than the PowerPoint.
Yeah.
Is that right?
There we
now
go.
it's okay.
Okay. So let's connect in the chat, or feel free to unmute yourself. But what we want to talk through here is, like I said, what do you think the overall message is of this abstract? And then we'll talk about the issue that's being presented. So let's take a few minutes to read it through, and we'll start pulling from there. Okay, does anyone have any initial thoughts in regard to the message of this abstract? Oh, Brian, here we go. Gait assessment and cognitive assessment should be included in fall risk screening.
Yeah, if I was to choose one sentence in the paragraph that you sent, what the main message is, that would be the one.
Mhm. Yeah, I think that's a really good one to pull. Does anyone have any opposing thoughts about the overall message? Gait cognition and falls are closely related. So that's not opposing, that's supporting, which is great. That's another great message. So I think there's a good grasp on that. But overall, what can we pull and think about in relation to the issue associated with gait cognition falls? They're closely related, but what issue is kind of being presented here in order to build out an issue statement that would set us up for informing policy or practice in some way? Brana, a policy change is needed from fall prevention with limited success to gait and cognitive assessment screening, including gait training and behavioral modulation. That's a great and concise statement, Rana. Janet, how will you find and identify these people? How is the program to be delivered? Janet, are you talking about, by people, do you mean the people at risk?
Yes.
Okay.
Yeah.
Yeah, no, that's a great, a really good question, because I think whenever we think about program success, we, those at higher risk are often the ones who are the harder to reach. So that's a really great point. And I just want to acknowledge the chat. Current fall prevention strategies are limited in their success. Just based on my background, I would very much agree based on this. So there's a lot of things kind of being brought forward. So just to be cognizant of time and parse through these as well, we've pulled and developed a bit of a statement just so we can talk about it. So older adults living with cognitive impairment are at an increased risk of falls due to disruptions in executive function. Pairing gait assessments with cognitive assessments in fall risk screening is a promising way to assess fall risk and intervene with strategies for fall prevention. These assessments are currently not put into practice. So it's identifying gaps with that last statement, and then kind of bringing together what's being presented in the abstract. But one thing that we really want to talk about as well, and Janet, you also kind of highlighted it, and Rana as well, but what additional information do we need to continue on with this? If this issue statement is the start of our policy brief, what else do we need to know? What other information could even improve this issue statement, and where could we potentially look? Any ideas about what might be missing, or what kind of things might strengthen the issue statement? Stats data, of course. I think we're reaching agreements about stats. So yeah, the prevalence of anything around this would be extremely helpful, because it really gives you this benchmark to work from whenever you're then setting out rationales and proposing recommendations, of course, because then in your background, if you have, and even with your research findings, if you have kind of not opposing data, but data to support the scale of reduction in falls and things like that, you can really build out the narrative and get a sense of how this can really help improve, not improve the issue, improve the outcomes that patients are experiencing, and really, really reducing falls in an overall sense for the healthcare system. So stats will absolutely help support just strengthening this issue statement, because one of the other points that we haven't quite touched on yet is really making an impact. This is the first sentence or three that someone's going to read. So how do you get their attention at the outset? And stats can really get their attention. So just even to tie in one example, in relation to screening, during some of these courses that we've done, one of the HQPs stated that 100% of people diagnosed with Alzheimer's disease have lost their sense of smell. And this was in relation to a rationale for early smell testing to help with early detection. So just that, for example, is it's a shock factor, right? So Brian, would simpler language help? Oh, I'll just
open it.
I think. There we go. So Brian, you're absolutely right. Depending on the context and depending on who, like who your audience is, they might have that technical skill set that it's still appropriate language, but you can see here like disruptions in executive function and cognitive impairment, and some of this language can be, it's absolutely not plain language at this stage. So it all depends on who your audience is. So I would absolutely, if you're trying to do outreach to community groups and community organizations where you can't make the same assumptions, then assumptions being their kind of level of education, absolutely try to be as plain language as possible. And Microsoft even has tools, there's tons of tools out there to assess grade level. But if you're in a position where you're trying to inform clinical practice with, among an audience of clinicians and healthcare administrators, they would likely be able to understand that technical language and the messaging that you're promoting. So absolutely right, but consider your context, because it often in plain language, your message, it's not misconstrued in any way, but the background that helps you set your rationale can be diluted, if that makes sense. Any other questions or thoughts associated with what can strengthen the issue statement? Any questions about the template that we brought forward? All right, that's great. Oh, the template is very helpful. Yes. And we will make sure, we'll work with Allison at AgeWell to make sure you all get like a document of that, as well as the slides. But yeah, so Janet, could you be challenged to first fall-proof homes? So that's a really great point in terms of the fall prevention example. There's a lot associated with trying to fall-proof homes. Doing home assessments is one thing that occupational therapists and physiotherapists that work in homes would want to start at, is that home assessment. And it really depends, because getting into people's homes can be viewed as invasive. So there's a lot of perception issues that you need to get around. But making homes as safe as possible is absolutely one of those kind of key things and ideal things to support people aging in place. So it just depends on the boundaries around what we're talking about. Are we talking about technology to support and even fall detection technology? Are we talking about just kind of cleaning up the home and putting in grab bars and things like that? These things can be expensive. So depending on how you set up your rationale, are you looking to get governments to improve their stipends or reimbursement for installation of grab bars, for example? And how does the province, or who is responsible for those kinds of reimbursements within government? Who is responsible? So then that's who you can reach out to. So that's an excellent point. In terms of fall prevention, there's just a lot to consider in terms of the boundaries and the solutions that we're looking at in the home. We have about 5 minutes, so we have time for more questions or.
I noticed there's one here by Jonathan. How long does this process usually take?
Oh, great question. Patrick,
yes.
you want to take a stab at that?
No.
No.
Well, I guess what I would say, I'm assuming that I was going to ask, is that a question in regard to how long does it take to develop
Right.
policy statements from a body of research?
Yeah.
And if it were up to me, my stock response would probably be, it depends.
Mhm.
But I think one of the things I do think, though, is that you can actually start taking these things into account earlier in the process. So if you already know that your research is likely going to be informing policy questions, bringing in during the initial scoping exercise to define the research itself, and thinking at that point where it's going to be potentially applicable, can shave time off later in the process when you're thinking about, okay, now I've got the data, how can I turn it into something useful? But you've already got the notion in your head about who may be a potential user for it, and building in those other components as well to the research process can actually go a long way to smoothing the process out in terms of aligning with the policy environment around you.
Absolutely. And I guess it would be helpful, Jonathan, if you want to unmute or respond in the chat, is that the process that you were talking about, or are you thinking more so in an informing policy and policy change?
No, this is absolutely what I was talking about.
Okay.
So I work with social entrepreneurship. So a lot of people that are aiming at putting these alternative into application. And a lot of time what we do is we say, go and grab research, promote with data and third parties that are neutral that will demonstrate that what you propose has an efficiency level, a high efficiency level. So we encourage them, and we expect, I'm saying random numbers, but like once you have the numbers, like a good 4 or 5 years of providing the pilot project, evaluating by the government, and then arriving with the proposal for a policy change, before it takes effect, or but I'm curious in your field if you've seen some type of benchmark on timing. Is it 10 years? Is it a decade? Is it 15 years? Is it?
It's complex because being able to identify your direct contribution to a government's decision to change policy is still very difficult. And I'll give AgeWell as our example because we all know AgeWell here. But the federal government just put technology as a priority as part of their FPT roundtable with ministers responsible for seniors. So that was after 5 years of AgeWell's existence and engagement with government and demos and introductions. So it really depends on a lot of factors. So 10 years is probably a good example too. And it really depends on the trends and the position that government ends up being in. Technology, what also probably played into the technology aspect was COVID-19 and the need for technological innovations in someone's home to support whenever we're physically constrained. To be able to discern what direct impact is with more complex challenges like this, very difficult. But if we're talking at a clinical level or municipal level, it might be a lot easier and quicker to discern the pathway and the timelines because it's a bit simpler of a problem to tackle, if that makes sense.
Yes, thank you very much.
All right, Brian, thank you so much. And we are at time. So I thank you all for your participation and your questions. I hope you got something out of today, and we can absolutely share all of our resources with you offline.